Hey there and welcome. If you've just brought a new cat home, first of all, congratulations. But I know that along with all the purrs and playtime, there can be a little bit of anxiety. And that's exactly why we're doing this. We're going to break down one of the most stressful parts of being a new cat owner, figuring out when your cat is just being a cat and when they might actually be sick.
And here's the thing. This is the core challenge. Cats hiding pain isn't them being dramatic or mysterious. It's a survival instinct baked into their DNA. See, out in the wild, showing any sign of weakness makes you a target. So your cat is literally hardwired to hide it when they're not feeling well.
And that is the big question, isn't it? It's the one that can keep you up at night. You see some tiny little change in their behavior and your mind starts racing. Am I overreacting or is this actually serious? That feeling is completely normal, but we're going to help you turn that anxiety into confidence.
So think of this guide as your personal decoder ring for all things cat. You're about to learn the tools to understand the subtle language your cat is speaking, which will turn that worry into real, actionable knowledge. It's how you become their best advocate.
Okay, first things first. This is probably the single most important skill you can develop as a cat owner. Before you can ever spot what's wrong, you have to get to know what's right, what's totally normal for your specific cat. Because believe me, every single one is different.
These are your big three, your pillars of observation, and it's the little changes here that can signal some pretty big problems. When your cat turns their nose up at food, it's not always them being a picky eater. It could actually be that their teeth hurt. Or if your usually social, out-and-about cat is suddenly hiding under the bed, that's not just them being shy, it could be a sign of a fever. Any change in their normal pattern is your signal to start paying closer attention.
It's almost impossible to spot gradual weight loss just by looking at your cat every day. Your eyes will play tricks on you. That's why you gotta track the numbers. A scale doesn't lie. This super simple 4-step process once a month gives you cold, hard data. It lets you walk into a vet and say, he's lost half a pound in the last 2 months, instead of just, I think he seems a little thinner.
All right, so once you've gotten that baseline down, you'll be way better at spotting the red flags. Now let's talk about the scary stuff. The situations that are not a wait-and-see kind of deal. These are the moments where acting fast can literally save their life.
Okay, listen up, because I cannot stress this enough, especially if you have a male cat. A urinary blockage is what you call a drop everything and go to the emergency vet right now situation. Without help, this can become fatal in just 24 to 48 hours. It is that serious.
These aren't just little hints, folks. These are blaring red sirens. When a cat can't pee, toxins build up in their system, their kidneys start to fail, and their bladder can even rupture. If you see your cat doing this, you do not wait for your regular vet to open in the morning. You go to an emergency clinic immediately. Now, everything we've just discussed, for kittens, you have to turn the dial up to 11. They are just so incredibly fragile. An issue that might be minor for a full-grown cat can become a full-blown crisis for a kitten in just a few hours. They just don't have the body reserves to fight things off. Okay, so here are 2 super quick checks you can do right at home. First, gently lift their lip and look at their gums. They should be a nice, bright pink. Think bubblegum. If they're pale white or grayish, that's an emergency. It means they're not getting enough oxygen. Second, gently pinch the skin at the scruff of their neck. It should snap right back down. If it kind of stays up in a little tent, even for a second, they're dehydrated. With a kitten, you never, ever wait until morning for problems like these.
Being a good cat parent doesn't stop at your front door. It's also about being a confident and informed advocate for them when you're at the vet's office. Remember, nobody knows your cat better than you do.
I want you to burn this sentence into your brain. Seriously, if your cat is having litter box issues and a vet just immediately says, oh, it's behavioral or it's stress, without running a single test, you need to push back. This phrasing right here is perfect. It's respectful, but it's also firm. It ensures a real medical problem isn't getting missed. So the vet agrees to the test, but now you got to get the urine sample. They might tell you to just use an empty litter box. Well, let me tell you the reality of that. Your cat is going to look at that empty plastic box and decide to hold it for the next 12 hours. A much better way is to use a special non-absorbing litter, or even some clean aquarium gravel. It feels normal to them, so they'll use the box, and you can just pour the sample right out. Easy.
And that same idea, that same spirit of being their advocate is so important for other common issues too. It's all about trusting your gut and knowing when it's time to get a second opinion if a diagnosis just doesn't feel right.
Let me tell you the story of a cat named Stash. It really drives this point home. So, Stash has a routine dental, gets sent home with antibiotics. He finishes them on day 10, but 2 days later, he starts having tremors and stops eating. The first vet just blows it off, gives him some useless gel. But the owner knew something was wrong. They went to a second vet who immediately diagnosed a bacterial infection from the dental work, gave him the right antibiotics, and within days, Stash was back to normal. That second opinion, well, it was absolutely life-saving.
So the big takeaway from Stash's story is to keep an eye out for these specific red flags after any dental work, especially the tremors. That can be a classic sign of pain from an infection. These kinds of symptoms need a real diagnosis and real medicine, not a placebo. Never, ever be afraid to question a diagnosis that just doesn't add up. All right, to wrap things up, let's do a little rapid fire round and bust some really common and sometimes pretty dangerous myths about cat health. Knowing the truth here can make a world of difference. Okay, myth number 1. This is a big one. We all hear a cat purring, and we immediately think, oh, what a happy, content little kitty. But here's the thing, that's just not the whole story. A cat that's in a lot of pain, or one that is absolutely terrified at the vet's office, will often purr. It's a self-soothing mechanism, like a little vibrational hug to calm themselves down. So you always have to look at the whole picture, not just the sound. This next myth is a really tough one, and sadly, it has led to so many cats being surrendered to shelters. It's the fear around a parasite called toxoplasma. But let's look at the actual reality here. You are far, far more likely to get this from handling undercooked meat than from your cat. The parasite only becomes infectious after the cat's poop has been sitting in the litter box for more than 24 hours. So as long as someone in the house is scooping the box every day, the risk is practically zero. You don't need to get rid of your cat. And this quote, this really just says it all, doesn't it? Look, you will absolutely make calls to the vet where it turns out to be nothing. And you might feel a little silly. But it is always, always better to feel a little foolish for overreacting than to feel that terrible regret of waiting just one day too long. Always trust your gut. So, we've gone through a ton of info here. My question for you as you're sitting there is this. What's one simple thing you're going to start doing today? Are you going to start that monthly weight log, or maybe just pay a little closer attention at mealtimes? You now have the toolkit. You have what it takes to be an absolutely amazing advocate for your new best friend.